fight cancer better. The goal of this webinar is to raise awareness about the importance of holistic care in cancer treatment. This aims to highlight how maintaining a healthy body through nutrition, physical therapy, mental health support, and complementary treatments can significantly improve the quality of life for cancer patients and enhance their ability to fight and win. By bringing together experts from various fields, this webinar seeks to offer valuable insights and practical guidance on integrating supportive care to improve patient outcomes and overall well-being. So before proceeding further, as mark of our tradition, let us take the choicest blessings of Ma Saraswati, the goddess of knowledge, to virtual lamp lighting. For this, I request technical team to please do the needful. Thank you. In Indian culture, guests are treated as God. Reflecting our deep respect and heartfelt hospitality, I kindly request Honorable Vice Chancellor Dr. Upinder Dhar to welcome the guest speakers, Dr. Dikpal Dharkar, Surgical Oncologist, Indian Institute of Head and Neck Oncology, Honorary Secretary, Indore Cancer Foundation Charitable Trust, Indore. I also request Honorable Vice Chancellor to welcome Radiation Oncologist Dr. Priyanshu Tripathi, Dentist Dr. Kratika Kulkarni, Dietitian Ms. Shubhi Malviya, Senior Physiotherapist Dr. Subhodh Srivas, Ayurved Physician Dr. Sonali Gore, Counselor Ms. Pooja Patel from Indian Institute of Head and Neck Oncology, Indore Cancer Foundation Charitable Trust, Indore. Thank you. It is my great pleasure to invite Honorable Vice Chancellor Dr. Upinder Dhar for the welcomings.
Good afternoon to all of you. At the outset, I would like to welcome Dr. Dikpal Dharkar and all the resource persons for today's webinar. As we know that supportive care is gaining a lot of importance. In addition to the main treatment, various hospitals are adopting different strategies to extend supportive care to the patients of cancer. As Triple V chapter of the Friends of Indore Cancer Foundation, has been organizing various activities from time to time, including awareness programs, so that people know more about cancer. They take preventive measures and spread the message. This webinar is one such effort to make people aware, to make our students aware, to make our faculty aware about this disease. When it comes to supportive care, we talk about pain management, symptom management, nutritional support, psychological support, social support, spiritual support. These days, particularly I've seen in US, spiritual support is given a lot of emphasis. And then rehabilitation and physical therapy. It has been observed through research and experience of the practitioners that there are many benefits of supportive care. For example, improved quality of life of the patient. Second, enhanced symptom management, increased patient satisfaction. Patients are more satisfied when supportive care is also provided in addition to the main treatment. Better adherence to treatment and reduced healthcare utilization. Supportive care can reduce healthcare utilization, decreasing hospitalization, emergency department visits, and other healthcare costs. But at the same time, there are many challenges, and then those challenges can also be treated as opportunities. So we can say challenges and opportunities. For example, access and equity. Ensuring equitable access to supportive care services, particularly for underserved and vulnerable population. Second, integration with medical care. Integrating supportive care with medical care to provide comprehensive and coordinated care. That coordination is very important. Medical care cannot be extended in isolation. Now, the current and contemporary understanding is that there has to be collaboration, good collaboration, so that comprehensive approach could be used. Thirdly, personalized care, providing personalized supportive care that addresses the unique needs and preferences of each individual. Family and caregiver support, providing support and resources for family members and caregivers who play a critical role in caring for individuals with cancer. And further, research and innovation. Advancing research and innovation in supportive care to improve outcomes, reduce symptoms, and enhance quality of life. We are very happy that today Dr. Darkar and his colleagues from the Institute are here today on the virtual mode. They'll be sharing their experiences with all the participants, and all of us will be richer in our understanding about supportive care in cancer by the end of this webinar. So once again, I welcome all the resource persons and Dr. Dikpal Darkar to this webinar. Thank you very much.
Thank you, sir, for your earnest welcome address. Cancer is a word, not a sentence. Cancer is not a dead sentence. It's just one word in your sentence, one part of your life. Now, I would like to invite Dr. Navneeta Upadhyay, member ICF SWV chapter, to introduce us all to the epitome who has selflessly devoted all his life to create a positive impact in the ones suffering from cancer.
Good afternoon to one and all present here. I am Dr. Navneeta Upadhyay, feeling honored to introduce great personality, Dr. Dikpal Darkar. Dr. Dikpal Dharkar is surgical oncologist, Indian Institute of Head and Neck Oncology, and honorary secretary, Indore Cancer Foundation Charitable Trust, Indore. Journey of a renowned personality, Dr. Dikpal Dharkar began with the completion of his medical graduation from Indore. He did his post-graduation from Tata Memorial Center, Mumbai, where he also did junior residency, rotating senior residency, and fellowships for about 6 years. Thereafter, he received 5 international fellowships, cantonal funding of the government in Switzerland, a scholarship of Dutch Ministry of Education in Netherlands, British Council Award in UK, foreign residency in head and neck oncology in Paris, and visiting fellowship at the Memorial Sloan Kettering Cancer Center, New York. After returning to India, Dr. Dikpal Dharkar made the singular decision to work towards the establishment of Indore Cancer Foundation Charitable Trust in order to develop a national center for India's commonest cancer, the head and neck cancer, and to bring scientific treatment of cancer within the reach of every patient, irrespective of socio-economic status. Dr. Dharkar returned to India with a dream, not in search of consensus, but to mold a consensus and thus begin the history of Indore Cancer Foundation Charitable Trust and Indian Institute of Head and Neck Oncology. In fact, the story of the birth, nurturing, and growth of ICF and its offshoot, the Indian Institute of Head and Neck Oncology, is the story of Dr. Dikpal Dharkar's dream, vision, commitment, hard work, and pursuit in the belief that nothing is impossible. Beginning with raising awareness, educating the public, including students, nurses, and physicians, on the importance of early diagnosis and treatment, and developing programs for training, Dr. Dikpal and his team successfully penetrated the interior villages of Madhya Pradesh. Team from ICF have conducted hundreds of camps, screening over 250,000 people, and performed thousands of free surgeries, which is no small feat. Significant attributes of Dr. Dharkar's professional work are over the last 32 years of surgical oncology practices, his consultations are totally free. Almost 30% of cancer surgeries done by him have been free of cost. He has attended almost all the 227 free cancer camps held by ICF in Madhya Pradesh, Rajasthan, Chhattisgarh, Maharashtra, Gujarat, and Uttar Pradesh. Their legacy is said to significantly influence the future availability of ultra-modern cancer care for all in Indore and its surrounding regions. The unwavering dedication of Indore Cancer Foundation, which prioritizes the needs of most undeserved and is expected to inspire the establishment of many more such centers in the years ahead. Thank you.
Thank you, ma'am. I would now like to humbly invite surgical oncologist Dr. Dikpal Dharkar for his address.
Thank you for the kind introduction. Thank you, Dr. Upender Dharji, and we are very, very grateful to you because under your vision and leadership, over the last few years, we have seen tremendous work by the friends of Indore Cancer Foundation, Sri Vaishnav Vidyapeeth Vishwavidyalaya chapter. So I would like to thank all of you, all the coordinators, all those who supervise the work, and last but not the least, all those who are members of the Sri Vaishnav Vidyapeeth University, the Indore Cancer Foundation Friends chapter for doing this. Now, when you talk of cancer, since we are talking of supportive care, it is important to note, this is an unprepared lecture, so I'm going to give you an extempore lecture, but I will stick to my time because we have a faculty which is well prepared to give you pearls of wisdom from their knowledge and experience. 5 or 6 years ago, there has been a paradigm shift in supportive care of cancer. So the question is, why are we bringing supportive care into focus here to non-medical audiences? The important message to convey here is this, that 6 years back, somebody from outside India actually said that supportive care is being offered as a reaction to the patient's symptoms. That if the patient has trouble, a care and support is offered to him. But the gentleman who did this work said that it is much better to be proactive in terms of supportive care rather than reactive. And thus began the concept of early integration of supportive care, which means that you actually offer supportive care right from the time the patient begins treatment. So you do not wait for the patient to say, I'm not hungry, I don't get the appetite, I'm not able to move, I have a depression, and then react to it. You actually try to imagine what can go wrong. You communicate with the patient, you go through the clinical parameters, and you offer established supportive care norms and try to learn from the experience of each and every patient. To that extent, we have moved quite a bit in the Indian Institute of Head and Neck Oncology because we are one of the few centers in India. I'm very happy to tell the respected Vice Chancellor who have taken early integration of supportive care in all its earnest. And we are actually doing it as one of the national level pioneers in early integration of supportive care, thanks to my team here, the young people who work day in and day out to raise the standard of care of supportive care. Now, why is supportive care in an early integration setting helpful and important? As the Vice Chancellor, Dr. Upender Dhar said, there's no doubt about it that it is much more cost effective, it reduces admissions, and it offers continuity of treatment. The continuity of treatment without interruption actually offers a better survival and a better cure rate. So if people have symptom control done at the time of beginning of the treatment, throughout the journey of the treatment, they are looked after better, their interruption of treatment is less, and the survival is better. Now, we all know that survival in India, in the Indian setting, is about 15% less as compared to the developed countries, but we are trying to slowly make that gap smaller and smaller as a collective effort of all the people who handle the leadership of cancer centers in India and who are into healthcare administration, trying to take decisions that will affect grassroots level care of the cancer patients. And this is what is happening as India emerges to become a more powerful and developed country, which is our vision and our dream. And we are proud to be part of that dream. Now, in terms of figures, and I want to tell this to the students, you have to know that numbers of cancer patients are on the rise. It is predicted, I think, that 1 out of 9 or 8 unborn child or a child born today in his or her lifespan is at risk for developing cancer. So if you look at the situation, it is troublesome, it is gruesome, it is scary, it is alarming. But then there is a paradigm shift in terms of detection also. That early detection offers you cure rates, which are much, much better. They're almost like higher chances of cure and really good chances of living a normal life. Therefore, the aim has to be early detection, which will improve the results. That is also cost effective. The other component that you must try to understand, and I'm trying to give you a carry home messages to all the young friends of the Indore Cancer Foundation of Sri Vaishnava Vidyapith chapter, that 1/3 of all cancers are preventable, which means that the biological history of cancer is known, the evolution of that cancer is known, the lampposts or the clinical parameters that give rise to pre-cancers are known, and if modified and interrupted by taking necessary, appropriate, and bold decisions, a pre-cancer can convert back into a normal tissue. Once somebody gets cancer, it is irreversible. But 1/3 of cancer can be prevented by modification before cancer develops. This means that we have to try and educate the people in India that drinking alcohol is bad. Taking alcohol with tobacco is like adding kerosene to fire. And having obesity is a bad thing. not having a active physical life and not doing the necessary exercises increases your risk of cancer. So there are multiple lifestyle modifications that must be brought into focus when you talk in terms of cancer prevention. There are, of course, known biological factors which cause cancer, like bacterial infections, viral infections, and so on and so forth. But those which are preventable are largely related to lifestyle, clean food, and hygienic style of living. And obviously, you have to follow a certain personal discipline because it has a direct impact. So, in terms of cancer, 1/3 of cancers are preventable, and 90% of people with cancer can get cured if they are detected at the first stage. That said, our job here is to actually educate people to get the scientific material on the fingertips. The Indore Cancer Foundation, which has a powerful leadership, not just me alone. I had only the medical part of it, and there are very, very learned people also participating with me, have developed a app known as a Cancer Sanket, which is available on the mobile phone, translated into 8 Indian languages, and is free of charge both on iOS and Android phones. So the Friends of Indore Cancer Foundation, Sri Vaishnav Vidyapith chapter, should try to disseminate information on this Cancer Sanket app so that people actually learn how to use that app, because it will give them information in their own vernacular language on what are the reasons that cause cancer, how can cancer be prevented, and how can you detect it early. The app also contains information on what tests should be done. Today the trend is, if you do a sonography, the sonologist will write down, do a CT scan. If you do a CT scan, they will say, get an MRI done. So there's no end to investigations. So let us not become driven by, ye test nahi hui hai, ya wo test nahi hui hai. Let us try and go by believing that there are good doctors who will try and save your money and who can give you the necessary answers, which tests are important for you and which tests are not important. Therefore, I think a message has to be clearly driven that just to get investigation is not the answer. One has to really look into it, why this investigation is required and why that is not required. Also, please note, message to the younger members of the Sri Vaishnav Vidyapith University chapter of Friends of Indore Cancer Foundation, that it is much more cheaper, less costly, more cost effective to have treatment of cancer at the first stage. Because in the first stage, you require only one single modality of treatment, whether it is radiation or surgery. As the disease advances, you have to go to multidisciplinary treatment modalities, which are more costly, and in terms of supportive care, also cause a heavy burden on the human body, because the body, Mother Nature has made it, has a lot of resilience, capacity to tolerate a lot of stress and strain. But if you have multiple inputs, chemical inputs, chemotherapy, and all those things, it does need supportive care. Therefore, I thought that the decision of the Vice Chancellor to have this supportive care seminar plays a very, very important role. That said, I hope you have a good time period ahead. I thank you for inviting me. I would like to express my gratitude to the Vice Chancellor, to Supriya Vyas Madam, and to all of you for inviting me and doing us the honors. We have always considered it a matter of great privilege and honor to be part of the Sri Vaishnav Vidyapith University whenever they give us the privilege to invite us. I'm now handing over the mic to my next speaker, Priyanshu Tripathi. And I am sure that you will learn from him new things. And the younger cadre of people, Shubhi, Subodh, Pooja, and Sonali, they are all waiting with 7-8 minutes of presentation, which will give you a broad perspective of what supportive care is. Thank you for inviting me. I'm going to have this chair vacated, and in 10 seconds, Priyanshu will be with you. Thank you. Jai Hind.
Thank you, sir, for your address. Radiation oncology transforms the power of technology into a beacon of hope. It's not just about treating cancer, but about enhancing lives, offering patients a chance for healing, and paving the way for a brighter cancer free future. Now, I would like to call upon Dr. Priyanshu Tripathi, MD, Tata Memorial Center, Mumbai, radiation oncologist, Indian Institute of Head and Neck Oncology, Indore Cancer Foundation, for his address on the topic 21 Things You Should Know About Cancer in 2025.
Will you share the presentation or should I? Because I have shared the presentation with you.
Aarti ma'am, please share the slides. Slides are visible?
Yes, it's visible. Should I start?
Yes, sir.
Yeah.
Okay. So, hello, good afternoon, everyone. I am Dr. Priyanshu Tripathi, and who have the access to this? Like, I have not changed it. Can you just, yeah. No, sir, but it's getting changed, which I have not changed. No, I don't want. Can you give me the access? Or can you just go back to the first slide and I'll just tell you to please go to the next slide and then you can change. Yeah. So today I'll just give you 21 key points about cancer. These are not a very technically detailed points. I just want to give you a brief idea regarding what cancer is and what should be the awareness about cancer should be there in the audience so that we can prevent it and we can also treat it if it comes to the treatment part. Can we just go to the next slide, please? Yeah, so I will just try to cover in these 21 points the awareness, the prevention, the screening part, and the various modality of treatment of cancer, right? So can we just go to the next slide, please? So we'll just see what is the definition of cancer and why cancer awareness is important. So by definition, it is the growth of any body cells which is uncontrollably and spread to other parts of the body. So in medical school, we have been given a definition like we call it as UAE, which is uncontrolled, abnormal, and excessive. So which is something which is uncontrolled, like body has no control over it, which is abnormal. Let's say, for example, if patient is having abnormal thyroid cells, like in a thyroid patient. So these abnormal thyroid cell will not function like a normal thyroid cell, and it will not give thyroid hormone as a normal cell, which gives. And they are in excessive number, like there is no control also. There is no process which is stopping them from growth. For example, few cancers, I'm sure you know, lung cancer, breast cancer, and everything. Yeah, next. So how this cancer develops? So I'll just give you a brief idea. 71%, almost 70 to 71% cancers, they are sporadic in nature. Sporadic means they just occur without having any familial hereditary. And these gene mutations, they somehow, through various processes, they develop into abnormal cell growth. So there are many kinds of cell mutation, gene mutation, which is oncogene and tumor suppressor. So oncogenes, they are something which if get mutated, it start developing into abnormal cells. And tumor suppressor genes are the genes in our normal DNA structure which prevents from tumor growth. So if there is any mutation in those growth, in those uh, 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 next please. So what nomenclature we use for naming the cancer cell? So depending upon the cell of origin, we just give them names. So, for example, carcinomas, they generally occur from epithelial cells. Depending upon the growth origin, we just give them names. For example, breast cancer, it's a carcinoma. Bone cancer is a kind of endodermal connective tissue carcinoma, so we call it sarcoma. Hodgkin's lymphoma is a kind of good kind of lymphomas. So depending upon the origin, we just give them names. So what are the most common cancers in India? We all know in men oral cancer, because especially in North India we use very heavy uses of tobacco, betel nuts. It's very prevalent, so that's why we see large number of oral cancers. Lung cancer mostly involved with BD smoking and tobacco smoking. Stomach cancer, esophageal cancer, and in women it is the most common malignancy is the breast, followed by cervical and ovarian malignancy. Next, please. So we all know, tobacco causes cancer. So smoking in India is the leading cause of lung cancer. So almost around 85 to 87% of the lung cancer, they are somehow related to smoking, which if stopped can, it will give us a large economical boost if we can prevent such amount of, it's a very lethal kind of cancer. So which can be prevented by just cessation of smoking. Next, please. So we have seen tobacco, and now we will see alcohol. So excessive alcohol consumption, there are multiple guidelines like what is the optimal use of alcohol. So every country gives a different guideline. So, but in any excessive use of alcohol consumption, it will at some point lead to liver cancer, esophageal cancer, larynx cancer, which is mentioned here as throat cancer, and breast cancer. So females who will drink excessive amount of alcohol, they will be at higher risk compared to the normal audience for development of breast cancer. Again, the diet involvement in the development of cancer. So we all know processed meat, like in the Western world, you will see they eat a lot of smoked meats and high fat diet. So that is why there is a high incidence of colorectal cancer, and even in Japan. So these are related to red meat. So, and in our country, because we eat lot of vegetables, so compared to the Western countries, we don't have very high incidences of colorectal cancer. But nowadays, because we are following almost Western food culture, so we have seen over last, I think, 1 decade, there is an increase in the colorectal cancer. So we can assume that yes, diet plays an important role in the development of cancers. Next, please. Again, as sir mentioned, obesity and physical activity, they are also linked to, at some extent, development. And if we are physically active, we can definitely prevent malignancy and cancer. Next, please. And we just assume like hereditary causes are the major issue for the development of cancer. But no, nowadays, many data suggest there are multiple infections, viral infections, which can, and even bacterial infection, which can lead to malignancy. So, for example, the most common one is the human papilloma virus, right? So it is the most important cause in development of cervical cancer, oropharyngeal cancer, penile cancer. So these are basically due to not maintaining good hygiene, and that is why these cancers are especially seen in lower socioeconomic condition. Especially, I'm talking about the cervical cancer, also the vulva cancer, the vulva vaginal cancer. They are all related to HPV. We all know hepatitis B, it causes HCC, hepatocellular carcinoma, and which is a very, very, very bad prognostic disease. And nowadays we have seen H. pylori. If a patient is having H. pylori infection, are almost around 3 to 4% of them, some point of time with if the infection persists for years, it can lead to stomach cancer. Next, please. So now that we have seen the awareness part, what role does a screening play? So screening means we should just detect cancer at its very early phase or pre-malignant stage. Like in oral cancer, there is development of white patches in those population who use excessively the betel nuts, pan, and everything. So that's why these are the high risk patient, and we should screen them so that we can just intervene at the level of pre-malignant lesion. So, for example, in females, if there is a breast cancer runs in the family, so those females are at a high risk of development of breast cancer. So annual mammogram and should be done so that if there is any development of breast cancer, we can detect it and we can treat it. As sir suggested, a detection of early breast cancer and treatment of it is very cost effective. So we should focus greatly on screening and a simple blood test which is PSA. It will give us if the patient is at a risk of development of prostate cancer. A single blood test can give us a huge idea if there is any chance of development of prostate cancer. Next, please. This is just a picture to show you how a simple test mammography is. So this image is a normal mammography in which you see normal blood vessels. There is no tortuous, there is no lesion, and in the below image there is a small lesion which is we call it BIRADS 2, 3, 4. It's the number which we give depending upon the risk of breast cancer. So the higher the number, the higher chance of it uh, having a breast malignancy. So a simple X-ray can give us a huge idea, a good idea about whether it's a suspicious lesion or it's a normal lesion. Next, please. So so as we have seen, like infections also leads to multiple cancer. So if we can vaccinate these high risk individuals. For example, in the government of India is running a national program for teenagers in the college and the school. If a simple vaccine can lead to uh, great decrease in the number of cervical cancer development. So HPV vaccine can prevent cervical cancer. Hepatitis B vaccine, if proper immunization has been taken place, we can prevent liver HCC carcinoma. Next, please. So, what are the early warning signs? Everyone will ask me how to know what if the patient is having cancer or not. What are the signs? What are the symptoms that one should look for in a general population? So, very simple things, unexplained weight loss, like even the patient is taking a proper meal, he's running, and everything normal has been going on. Still, there is a significant amount of weight loss. How much weight loss? It is around 10 to 20% of the total weight loss occurring within 1 month, 2 months. So it's a significant weight loss. There is any lump, it's not painful. Even if it's painful, it's not going. It's insidiously, it's growing over a period of time. It should be screened. If there is persistent cough, a patient is a chronic smoker and there is a persistent cough in since 6, 7 months, so it should be evaluated. Unusual bleeding from rectum, from nose, or even from ear, so it should be shouldn't be ignored, and a proper evaluation should be done. Night sweats. So a majority of the lymphoma patient, they will just have these 2, 3 complaints. They will have unexplained fevers, they will have unexplained weight loss and night sweats. So if these are the simple signs, if if detected early and a proper evaluation has been done, we can prevent cancer at a very early stage. Next, please. So how we diagnose cancer? We all know biopsy should be done almost in all cancer. A simple blood test can also give us the whether the patient is having cancer or not in few malignancies like leukemia and lymphoma. But in majority of cancer, no, please go to the previous one. In majority of the cancer, biopsy should be done. Biopsy is just taking a small tissue from the lesion and examining it under microscope to see signs of cancer in a cellular level. Imaging like CT scan, MRI, PET scan, they help us in determining what is the stage of the cancer. So these are the diagnostic images, and simple blood tests like, for example, in prostate serum PSA, CEA, there are tumor markers, CEA, CA 19.9, CA 125. These are simple blood tests which gives us the prognostic indicator, like what is the load of the cancer. So simple blood test can also give us a huge amount of idea regarding cancer. Next, please. So what are the treatment modalities? Like I will just give you a brief idea. Like there are three treatments which almost at some point of time, almost all cancer patients, they do receive these three treatments. So surgery, radiation therapy, which is, using of high doses, high energy of X-rays to, and which are computer controlled to kill cancer cells, and chemotherapy. So drugs which are used in cancer, they are called as chemotherapy. So since I'm a radiation oncologist, I will definitely show you how we treat cancer patient using radiation therapy. Next slide, please. So, this is a machine which is called as linear accelerator. There is this couch on which patient is lying. Patient will just lie in on this couch, and this head is called as gantry head. There will be high dose radiation which will be delivered from this gantry head, and they are computer controlled. So we treat cancer patient, for example, in larynx cancer, in oral cancer, lung cancer, they all can be treated using this machine, which is called as linear accelerator. Next, please. So what are the different types of chemotherapy? So immunotherapy and targeted therapy are the talk of streets nowadays. And immunotherapy is nothing but just training our immunity to attack cancer cells. There are various ways to do it, and it's very effective in few cancers. So that's why, for example, pembrolizumab, cetuximab, these are all immunotherapy which are used extensively nowadays in cancer patient. Targeted therapy are, all cancer, they give us a specific target. If we somehow identify those target, though, so these targeted therapy can be used, and the side effect is very less. At the same time, effect is very high. So targeted therapy are used extensively nowadays. Few example are like Jeftinib, which attacks EGFR, and there are bevacizumab, and all these targeted therapy which are extensively used nowadays, which are in practice. Next, please. So what are personalized medicine in cancer? So nowadays, we take tissue during the biopsy from a cancer patient, and we do genetic profiling of almost all lung cancer and few endometrial cancer, colorectal patient, stomach cancer, so that it will give us specific idea. So for example, in breast patient, we always look for hormone receptors and HER2 receptors, which are usually expressed in breast cancer patient. So if it's a HER2 positive breast cancer, then we have a targeted therapy for it called as trastuzumab, and it will give us a very good response to this chemotherapy, which is targeted therapy. Next, please. So since you will listen to our supportive care team after my session, so emotional support, good diet, good psychological support, good physiotherapy, they all play very, very, very crucial role in, treatment and rehab part of the cancer patients. Next, please. So what are the myths versus facts about cancer? The most myth, the important myth, the common myth which all feel regarding cancer, that if there is a cancer in a patient, it is almost always fatal. I just want to give you a fact. No, it is not right. It is not correct. Many cancer nowadays are curable if detected early, and many cancers, even in advanced stages, like breast cancer, like lung cancer, cervical cancer, vulva cancer, vaginal cancer, rectal cancer, even in stage 3 stage, they are curable to some extent, to many extent. Next, please. So oncology is a subject in which, maximum amount of research are being taking place, be it development of vaccine, therapy, targeted therapy, immunotherapy. So over a period of time, every decade, there is a paradigm shift. Initially, the only treatment for larynx cancer was surgery, but nowadays surgery is not the treatment at all in a laryngeal patient. Similarly, initially in cervical patient, hysterectomy, like doing surgery, was the main line of management, but during last 15-20 years, it is only treated with chemo and radiation. So there is very, paradigm shift are being taken care at a very high pace. Oncology is the subject in which maximum amount of research has been taking place. So in future also we will definitely have newer medicine, newer techniques to treat these cancers effectively. Next, please. So how can you reduce cancer? You don't need an oncologist to tell you, you have to quit smoking, you have to eat good, healthy meal, stay active, and get screened if you are at high risk of development of cancer. Next, please. So, awareness about cancer is very important. Prevention can be done if detected early, and screening can definitely save lots of life. Thank you. If you have any question, I'll be happy to answer them.
Thank you, sir, for sharing important details pertaining to cancer. Oral health is a cornerstone of overall well being, surpassing ages and stages in life. It is with this spirit of not only preserving our smiles, but our health for years to come. I would like to request Dr. Kratika Kulkarni, dentist, Indian Institute of Head and Neck Oncology, Indore Cancer Foundation, to address the audience with your diversified knowledge on the topic oral health across all ages, prevention, care, and challenges of oral cancer prevention.
Namaste, everyone. Can we have our slides, please? Next, please. It's great to be here with you all today to talk about something we often take for granted, that is our oral health. As college student, most of us focus on the career, college friendships, and future goals. But how often do we think of about oral health? Only when we time get cavity or a toothache, right? But oral health is something much more about just being a toothache or a cavity or clean teeth. It affects our confidence and ability to eat. Can we have next slide, please? Today, I want you to walk through the importance of oral health at different stages of life. Coming towards the first stage, that is early childhood and teenage year. Remember those days when our parents forced us to brush our teeth before school? We hated it, but then it saved us from cavities. Many of us had braces and extractions. Let's be honest, how many of us skipped flossing because it was too much effort? Coming to the college years, the careless phase. Late night study sessions, eating hostel food, drinking chai and coffee multiple times a day, and sometimes even skipping brushing because of a busy schedule. Does it sound familiar to you? Some students even pick habits such as smoking, chewing gutka, eating pan, and occasionally having alcohol for fun at a party. It starts as a casual thing. Over time, it becomes an addiction. Coming to the third stage, the adulthood or the old age. Once you start working, stress and lifestyle habit take a toll. Many adults face gum disease, tooth decay, or even loss of teeth due to negligence. Older adults, especially in India, often use tobacco for decades. Many of them are very highly vulnerable to oral cancer. Next, please. What causes oral cancer? Talking about the elephant in the room, the oral cancer and supportive care. When we think of cancer, usually we associate it with older people. But oral cancer is something which is growing crisis in India in early adults also. What causes oral cancer? The consumption of tobacco in form of smoking, eating the tobacco products, gutka, kheni, zarda. Coming to the betel nut chewing, that is one of the most common cause of something known as oral submucous fibrosis, which is one of the most common cause of reduced mouth opening, trismus, which we commonly called as. Coming to the alcohol, as my senior colleague already told, that alcohol consumption along with cigarette smoking accelerate the cancer process. Other than that, there are some bacterial and viral causes also which can lead to oral cancer. Next, please. Next slide. previous one. Early signs of oral cancer. So oral cancer doesn't always start with pain. The first sign of oral cancer can usually be just a simple sore on an ulcer, which doesn't heal for weeks. Another sign can be some precancerous lesion, which are not actually a cancer, but some white or red patches in oral cavity. Other than that, there can be some difficulty in opening of mouth, difficulty in swallowing or speaking, or hoarseness in voice. Next, please. Sharing a story, a friend of mine had a relative who had chewed pan for a few years and for just after meal a day. Once he had noticed a small ulcer in tongue, he ignored it for months. But what it turned later to be an oral cancer, and as a result, he lost part of his tongue. The lesson: don't ignore the small changes in oral cavity. It can cost you a life. Next, please. This was one case of an early term cancer. Why is dental care? Next, please. Why is dental care important in cancer treatment? So many cancer treatment affect oral cavity badly. For example, that surgeries or the radiation and chemotherapy, patients undergoing cancer treatment often undergo these treatment modalities, which often lead to conditions like xerostomia, as we can see in the first picture. Xerostomia simply means the severe dryness of mouth, which can lead to dental decay, as we can see in the picture below, dental decay or gum diseases and other things. Other than that, it can lead to severe complications, which we are handling very well at Indian Institute of Head and Neck Oncology, that is oral mucositis. Oral mucositis is generally the inflammation of the oral mucosa, oral cavity. Other than that, it can cause severe dysphagia. What is dysphagia? Dysphagia is something when patient is unable to swallow food or liquid through his food pipe. Next, please. So why supporting dental care at different stages of time? There are two modalities where we go as a dental community in head and neck cancer. For example, removing of infected teeth, cleaning and scaling of oral cavity. Fluoride important so as to save the jaw from the side effects of radiation therapy. Cleaning and scaling is again important to preserve what is present after the cancer modality or before going towards the cancer treatment. Fluoride therapy is for saving the dental hard tissues in the oral cavity and making mouth guards or splint. For example, few patients undergo cancer treatment or cancer surgeries have deviated mouth. So in those patients, we are giving splint to have the proper contour of the mouth and appearance and function as well. Next, please. Post-treatment dental care for recovery and long-term management. What is important is the regular checkup, rehabilitation with prosthetic. So many of us have seen cancer survivor patients with some lost part in their oral cavity. So that is restored with the help of something known as obturator, which is a part of prosthesis. Again, dentures and implants are placed and jaw exercise therapies are instilled in those patients. Next, please. What can we do as students to encourage our friends and family to quit tobacco and betel nut, to promote regular oral hygiene checkups, especially for those with the tobacco habits, educate people about early signs of oral cancer, support cancer patients emotionally, because kindness goes a long way for the therapy. Next, please. Final message: oral health is a lifelong commitment. It's not just one toothache or a cavity in a tooth, in a mouth. So today, let's take a pledge: no more tobacco, no more betel nut, no more ignorance. Regular checkups, good oral hygiene and awareness, supporting those fighting oral cancer. And your future, your dreams and your health matter. Take care of them today. Thank you, everyone. Any questions? I would like to answer them.
Thank you very much, ma'am, for igniting healthy smiles in our audience face. A well-balanced diet can strengthen the body, boost immunity, and improve quality of life, helping cancer patients navigate their treatment journey with greater resilience and hope. I would like to request Ms. Shubhi Malviya, dietitian, Indian Institute of Head and Neck Oncology, Indore Cancer Foundation, to enlighten us with expertise on the topic nutrition and cancer care, how to help a cancer patient with nutrition. Excuse me, ma'am, you're not audible.
Hello, now, hello, hello.
Yes, ma'am, you're audible now.
So today I'll be talking about the role of nutrition in cancer care and how to help cancer patient with nutrition. जैसे कि आप सभी ने सुना होगा कि कैंसर और कैंसर का ट्रीटमेंट एक डिफिकल्ट ट्रीटमेंट हो सकता है, डिफिकल्ट टास्क हो सकता है पेशेंट के लिए। पर यदि पेशेंट बैलेंस डाइट ले और बैलेंस डाइट ले तो वह अपने जो साइड इफेक्ट्स है, सिम्टम्स है, उनको मैनेज कर सकता है। तो सबसे पहले हम जानेंगे कि न्यूट्रिशन न्यूट्रिशन इन कैंसर केयर क्यों जरूरी। जैसे कि आप सभी जानते होंगे या आप सभी के पास स्कूटी, बाइक्स या कार होंगी, जिनको चलाने के लिए आपको पेट्रोल और इंजन ऑयल दोनों की जरूरत होती होगी। तो सेम हमारा बॉडी भी आप एक गाड़ी से ही मान सकते हैं, जिसमें अगर कोई प्रॉब्लम आ रही है या कोई डिजीज आ रही है तो उसके लिए हमें पेट्रोल यानी मेडिसिन की जरूरत होती है, साथ ही साथ इंजन ऑयल यानी फूड, बैलेंस डाइट और न्यूट्रिशन की भी जरूरत होती है। अगर हम अच्छा पोषण लें तो हम ट्रीटमेंट आउटकम को इम्प्रूव कर सकते हैं, साइड इफेक्ट को रिड्यूस कर सकते हैं, पेशेंट की रिकवरी को इनहेंस कर सकते हैं, एनर्जी लेवल्स को इनहेंस कर सकते हैं, साथ ही साथ उसके हेल्दी वेट को मेंटेन कर सकते हैं और मसल मास को भी मेंटेन कर सकते हैं। नेक्स्ट प्लीज। तो now I want to share with you the role of dietetics department at ICF under EISC, Early Integration Supportive Care। सो सबसे पहले हम पेशेंट का अर्ली न्यूट्रिशनल स्क्रीनिंग करते हैं, जिसमें हम पेशेंट को का टेस्ट करते हैं कि स्क्रीनिंग से ये पता करते हैं कि पेशेंट मालनरिज्ड है या एट रिस्क ऑफ मालनरिजमेंट पर है, ताकि हम उसका पर्सनलाइज डाइट चार्ट, डाइट प्लान कर सके, डाइटरी इंटरवेंशन कर सके, ताकि वो मालनरिज्ड कैटेगरी से इम्प्रूव होकर हेल्दी कैटेगरी में आए। हम एज हमारे यहाँ मोस्टली पेशेंट लोअर इनकम ग्रुप से आते हैं, ट्राइबल एरिया से आते हैं, तो हमने एक लो कॉस्ट ट्यूब फीडिंग फॉर्मूला तैयार किया है, जो कि बहुत कम अमाउंट, 8 रुपीज पर 200 ml में प्रोवाइड होता है पेशेंट को, और जिसमें सारे न्यूट्रिएंट, इसेंशियल न्यूट्रिएंट जैसे ओमेगा 3 फैटी एसिड, प्रोटीन, कार्ब्स, हेल्दी फैट्स भी से डेंस होता है। साथ ही साथ हम पेशेंट को थ्रू आउट द ट्रीटमेंट उससे के सिम्टम मैनेजमेंट पर ध्यान देते हैं। जैसे कि आप सभी को शायद पता होगा कि कैंसर ट्रीटमेंट से कुछ साइड इफेक्ट्स और होते हैं, जैसे नोजिया, वॉमिटिंग, एपेटाइट लॉस होता है पेशेंट में, डिफिकल्टी इन चूइंग होती है, सॉलोइंग डिफिकल्टी आती है। तो इन सबको मैनेज करने के लिए हम पेशेंट को उसके सिम्टम के अकॉर्डिंग डाइट प्रोवाइड करते हैं। रेगुलर मॉनिटरिंग एंड फॉलोअप, पेशेंट के साथ रेगुलर टच में रहते हैं ड्यूरिंग द ट्रीटमेंट एंड आफ्टर ट्रीटमेंट ऑल्सो, so that we can monitor his or her progress during the treatment, and patient और caregiver को डाइटरी इंटरवेंशन के बारे में एजुकेट भी करते हैं। नेक्स्ट प्लीज। So now we talk about the necessity of nutritional assessment in cancer patient. So nutritional assessment क्यों जरूरी है कैंसर पेशेंट का? To identify malnutrition in risk factor and risk factor early, to help in create a personalized dietary intervention and monitor the change weight, muscle mass and overall health. Next. तो जरूरी नहीं है कि हर बार आपको न्यूट्रिशनल असेसमेंट या पेशेंट का न्यूट्रिशनल रिस्क स्टेटस जानने के लिए आपको किसी स्पेशलिस्ट के पास ही जाना पड़े। आप खुद भी अपने पेशेंट का न्यूट्रिशनल असेसमेंट या न्यूट्रिशनल स्टेटस चेक कर सकते हैं कुछ बेसिक चीजों से, जैसे कि पेशेंट का वेट चेक करना। रेगुलर बेसिस पे आपको पेशेंट का वेट चेक करना है। अगर उसके जो आइडियल बॉडी वेट से मोर देन 5% पेशेंट का वेट लॉस हो रहा है, तो ये चैलेंजिंग हो सकता है कि पेशेंट का वेट लॉस क्यों हो रहा है, पेशेंट को कोई डिफिशियंसीज तो नहीं है, या पेशेंट प्रॉपर डाइट नहीं ले रहा है। लुक, फिजिकल अपीयरेंस, अगर पेशेंट की स्किन बहुत ज्यादा ड्राई हो रही है, येलो दिखाई दे रही है, मतलब पेशेंट की बॉडी में डिफिशियंसीज है। एक्सेस डाइटरी इंटेक, तो आप छोटा सा पॉकेट डायरी यूज कर सकते हैं, जिसमें आप पेशेंट का मॉर्निंग टू नाइट में जो भी इंटेक है, जो भी वो खाना खा रहा है, आप उसका नोट करते रहिए, और एट द एंड आप उसको मॉनिटर करिए कि दिन भर में उसने क्या खाया है, पेशेंट ने वो जितनी बॉडी की रिक्वायरमेंट है, या जो उसके डाइटिशियन ने या डॉक्टर ने उनको सजेस्ट किया है, वो उतना ले पा रहे हैं या नहीं ले पा रहे हैं। एनर्जी लेवल आप चेक कर सकते हैं कि पेशेंट या कोई इंडिविजुअल पहले जो उसकी फिजिकल एक्टिविटी थी, कि कोई काम बड़ी आसानी से कर लेते थे, लेकिन अब वही काम, सेम काम करने में उनको थकान होने लगती है, डिजीनेस फील होता है। तो आप ऐसे उनके एनर्जी लेवल चेक कर सकते हैं, और सिंपली कुछ ब्लड टेस्ट करा सकते हैं, जैसे हीमोग्लोबिन हो गया, एल्ब्यूमिन लेवल्स हो गए, या विटामिन लेवल्स चेक कर सकते हैं। नेक्स्ट प्लीज। सो हाउ टू हेल्प अ कैंसर पेशेंट विथ न्यूट्रिशन। जैसे कि आप सभी को मैंने बताया कि कैंसर और कैंसर के दौरान पेशेंट को कुछ साइड इफेक्ट्स आते हैं, कुछ सिम्टम्स आते हैं, जिनके कारण उनका न्यूट्रिशनल इंटेक हैम्पर होता है। तो यहाँ पे कुछ साइड इफेक्ट्स एंड सिम्टम्स है, और उसका न्यूट्रिशन सॉल्यूशन है। अगर पेशेंट एपेटाइट लॉस फील कर रहा है, या उसे भूख नहीं लग रही है, तो हम उनको छोटा छोटा मील, अगर हम पेशेंट के सामने एक पूरी थाली रख देंगे और उनको बोलेंगे कि खाओ, तो नहीं खा पाएगा। तो हम उनसे बोलेंगे थोड़े थोड़ा खाना, बार बार फ्रिक्वेंटली आप खा सकते हैं, और खाना ऐसा होना चाहिए जो डेंस कैलोरी, डेंस प्रोटीन और न्यूट्रिएंट रिच हो। जैसे कि आप स्मूदी बोल सकते हैं, शेक शेक बोल सकते हैं। अगर पेशेंट वेजिटेरियन है तो आप पनीर बोल सकते हैं, नॉन वेजिटेरियन है तो एग, फिश थोड़े अमाउंट में भी खाएंगे, तो उनको अच्छा कैलोरी, अच्छा प्रोटीन मिलेगा। अगर पेशेंट नोजिया वॉमिटिंग फील कर रहा है, तो आप एक जिंजर स्लाइस उनको मुंह में रखकर उसको चूसने बोल सकते हैं, जिससे उनको नोजिया में रिलीफ मिलेगा। आप उनको लेमन जूस बोल सकते हैं। आप उनको प्लेन फूड और ठंडा खाना खाने बोलिए, ताकि उनको वॉमिट या नोजिया फील ना हो। अगर पेशेंट को माउथ सोर, अल्सर्स हैं, तो हमको उनको सॉफ्ट मैश्ड फूड बोलना चाहिए, योगर्ट, स्मूदी खाने बोलना चाहिए। या फिर सिंपली आप उनको थोड़ा सा बिफोर ईटिंग द फूड उनको बोलना चाहिए, आप थोड़ा सा हनी अपने जहां भी अल्सर वाले एरिया में लगा लीजिए, ताकि उनको थोड़ा सूदिंग मिले और खाने में इजी हो। या फिर जो ग्रेटेड कोकोनट होता है या खोपरा होता है, उसको छोटे से साफ कपड़े में रखकर उसका एक पोटली बनाइए, और उसको मुंह में रखकर उसको चूसते रहिए, जिससे उनको अल्सर्स में रिलीफ मिलेगा। अगर पेशेंट को डिफिकल्टी इन swallowing है, अगर पेशेंट को निगलने में प्रॉब्लम हो रहा है, तो हमको उनको प्यूरीड फॉर्म, प्रोटीन रिच सूप्स और ब्लेंड फ्रूट्स देने चाहिए। अगर पेशेंट डायरिया है, पेशेंट को कंटिन्यूस डायरिया लग रहा है, तो आप सिंपली उनको कर्ड बनाना, कर्ड राइस, कोकोनट वाटर, लेमन वाटर या इलेक्ट्रॉल पाउडर सजेस्ट कर सकते हैं, जिससे उनका जो इलेक्ट्रोलाइट लॉस हुआ है ड्यूरिंग द डायरिया, उसमें उनको रिलीफ मिलेगा। अगर पेशेंट कॉन्स्टिपेटेड फील कर रहा है, तो हमें फाइबर रिच फूड सजेस्ट करना चाहिए, जैसे फ्रूट सैलेड्स, होल ग्रेन्स, स्प्राउट, और उनको अपना वाटर इनटेक बढ़ाने बोलना चाहिए। अगर पेशेंट को थकान और वीकनेस है, तो ये साइन हो सकता है एनीमिया का या डिफिशियंसीज का, तो हमें आयरन रिच फूड उनको सजेस्ट करना चाहिए, जैसे स्पिनच, डेट्स, जैगरी। तो प्रोटीन रिच फूड जैसे दाल, एग, चिकन, एक्सेट्रा। नेक्स्ट प्लीज। Now, there are some essential nutrients for cancer patients, and जो कि कैंसर पेशेंट के लिए बहुत ही, बॉडी के लिए बहुत ही जरूरी होते हैं ड्यूरिंग द ट्रीटमेंट। प्रोटीन, जो कि हेल्प करता है मसल मेंटेनेंस और इम्यून फंक्शन में, जिसके सोर्सेज होते हैं एग, फिश, पनीर, मिल्क प्रोडक्ट, दालें। ओमेगा 3 फैटी एसिड रिड्यूस inflammation and improve immunity, which source is flaxseed, walnut, and fatty fish. Iron and vitamin C prevent anemia and enhance absorption of nutrient, which sources are spinach, jaggery, avla, citrus fruit, and antioxidant vitamin C, A, E, selenium protect cell damage. जिसके लिए हम पेशेंट को सजेस्ट कर सकते हैं कि आप कैरेट खाइए, बेरीज खाइए, टर्मरिक ले सकते हैं, आलमंड ले सकते हैं, सनफ्लावर सीड ले सकते हैं, जिंक एंड मैग्नीशियम, जो कि वुंड हीलिंग में हेल्प करता है और फटीग को रिड्यूस करता है। इसके लिए हम पेशेंट को पंपकिन सीड, होल ग्रेन और पीनट सजेस्ट कर सकते हैं। नेक्स्ट प्लीज। देयर आर सम इंडिजिनस इंडियन फूड जो कि बेनिफिशियल होते हैं कैंसर पेशेंट के लिए, जैसे रागी, ज्वार, मिलेट्स। मिलेट्स बेसिकली मिलेट्स जो कि फाइबर रिच होते हैं, आयरन रिच होते हैं और इजी टू डाइजेस्ट होते हैं। आंवला या इंडियन गूसबेरी जो कि हाई इन विटामिन सी और एंटीऑक्सीडेंट होती है। टर्मरिक, ब्लैक पेपर एंटी इंफ्लेमेटरी प्रॉपर्टीज होती है इसकी। ड्रम स्टिक का आप फली भी ले सकते हैं, उसका पत्तियां भी खा सकते हैं, उसके फूल भी। ड्रम स्टिक एक ऐसा पौधा है जिसकी हर एक पार्ट एडिबल है हमारी डाइट में, और वो कैल्शियम रिच, दूध से 3 गुना ज्यादा उसमें कैल्शियम मिलता है और आयरन रिच फूड होता है। तुलसी एंड जिंजर जो कि इम्यूनिटी बूस्ट करता है, नोजिया को रिलीफ करने में हेल्प करता है। बटर मिल्क एंड कर्ड प्रोबायोटिक एंड गट हेल्थ के लिए बेनिफिशियल होता है। फॉक्सनट या मखाना सिंपली लाइट, हाई इन प्रोटीन एंड मिनरल रिच होता है। स्वीट पोटैटो रिच इन बीटा कैरोटीन सपोर्ट टू आई हेल्थ एंड रिड्यूस इन्फ्लेमेशन। टमेटो जो कि पैक्ड ऑफ ल्यूकोपेन होते हैं एंड एंटीऑक्सीडेंट दैट इनहेंस द इम्यूनिटी एंड प्रिवेंट द सेल डैमेज। नेक्स्ट प्लीज। सो यहाँ पर मैंने इन इंडिजिनस फूड को रेसिडेंटल एरिया के अकॉर्डिंग डिवाइड किया है। जैसे अर्बन एरिया में मोस्टली अगर कोई पेशेंट अर्बन एरिया का है तो हम उनको सजेस्ट कर सकते हैं स्प्राउटेड ग्रेन्स, फोर्टिफाइड डेयरी प्रोडक्ट्स, हर्बल टी और आलमंड या सोया मिल्क। अगर रूरल एरिया में पेशेंट है तो उनकी यहाँ एबिलिटी मोस्टली मिलेट्स की होगी, जैसे रागी, ज्वार, बाजरा। देसी घी आसानी से मिलेगा, सीजनल वेजिटेबल आसानी से मिलेगी, बटर मिल्क, कर्ड ये आसानी से मिल सकता है। ट्राइबल एरिया में वाइल्ड बेरीज उनको मिल सकती है, फॉरेस्ट हनी मिल सकता है जिसकी एंटी इन्फ्लेमेटरी प्रॉपर्टीज होती है। स्मॉल मिलेट्स जो कि फाइबर और आयरन रिच होते हैं। महुआ फ्लावर जिसकी एंटीऑक्सीडेंट प्रॉपर्टीज होती है, बाकी विटामिन सी रिच होता है। और लोकल ट्यूबर्स जैसे कंद वगैरह जो मिलते हैं वो खा सकते हैं। नेक्स्ट प्लीज। तो ये कुछ टेक अवे नोट्स हैं जो कि हम उनको आप पेशेंट को दे सकते हैं। उनको इंश्योर करिए कि पेशेंट बैलेंस डाइट ले, प्रोटीन, हेल्दी फैट्स एंड कार्बोहाइड्रेट रिच हो। पेशेंट को हाइड्रेटेड रहने बोलिए, 2 से 3 लीटर पानी मिनिमम दिन में पीना चाहिए। प्रोसेस फूड, जंक फूड अवॉइड करने बोलिए जो कि इम्यूनिटी को वीक करता है। प्रेफर होम कुक्ड मील और लोकल और सीजनल फ्रूट खाने बोलना चाहिए। पेशेंट को डिफिकल्टी ऑफ च्यूइंग है तो प्यूरिड फूड, सूप, स्मूदी वगैरह खाने बोलनी चाहिए। और अगर पेशेंट में एपेटाइट लॉस है तो स्मॉल फ्रीक्वेंट मील्स और डेंस कैलोरी फूड बोलना चाहिए। लास्ट में मैंने एक पोस्टर ऐड किया है जो कि ट्यूब फीडिंग के इंस्ट्रक्शंस है। अगर किसी पेशेंट को नाक से नली लगी हुई है तो उनको क्या क्या इंस्ट्रक्शन फॉलो करने चाहिए ये भी आप उनको सजेस्ट कर सकते हैं। जैसे ट्यूब छूने से पहले हाथ को अच्छे से वॉश करना चाहिए। पेशेंट को 45 डिग्री एंगल पर लेटा कर ही देना चाहिए फीड। अगर आप स्ट्रेट बैठा कर देंगे या स्ट्रेट लेटा कर देंगे तो पेशेंट एस्पिरेट या वॉमिट करने के चांसेस है, या फीड लंग में जाने या एयरवे में जाने के चांसेस होते हैं। पेशेंट को हर 2 आवरली फीड देना चाहिए। फीड देने से पहले पानी देना चाहिए ट्यूब से, और फीड देने के बाद पानी देकर अच्छे से ट्यूब को फ्लश करना चाहिए। नली से कुछ भी गर्म नहीं देना है। अगर पेशेंट वॉमिट कर रहा है या एस्पिरेट कर रहा है मोर देन 100 ml इन डिफरेंट कलर लाइक रेड, ब्लैक एंड कॉफी, तो हमें डॉक्टर को इन्फॉर्म करना चाहिए, क्योंकि अगर रेड कर रहा है तो हो सकता है अंदर जीआई ब्लीड है या फिर कोई इन्फ्लेमेशन है। ब्लैक कर रहा है तो आप प्लीज डॉक्टर को इन्फॉर्म करिए। और फीडिंग ट्यूब को फीड देने के बाद सीरिंज को फीड देने के बाद हल्के ल्यूकवार्म वाटर में वॉश करके साफ कपड़े में लपेट कर रखना चाहिए। That's it. Thank you for your kind attention.
Thank you so much, ma'am, for sharing your knowledge in an easy way.
एक मिनट उजला मैम, I have one question. Can I ask please?
Yeah, sure.
मैम एक्चुअली जैसे जब आपने न्यूट्रिएंट्स बताए विच आर बेनिफिशियल फॉर कैंसर पेशेंट्स, तो ये सारे न्यूट्रिएंट्स कैंसर प्रिवेंशन के लिए भी बेनिफिशियल होंगे क्या?
यस ऑफ कोर्स, अगर हम बेसिकली डेली रूटीन लाइफ में भी इनको यूज करेंगे तो कैंसर प्रिवेंशन में बहुत अच्छा हेल्प करेंगे। क्योंकि आज का जो डाइटरी इंटेक है, हम लोग मोस्टली जंक फूड खाते हैं जो कि हमारी इम्यूनिटी को वीक करता है। अगर हम हेल्दी एक बैलेंस डाइट लेंगे तो वो हमारे कैंसर प्रिवेंशन में बहुत अच्छे से हेल्प करेगा।
एंड मैम जैसे बहुत सारे ये आई डोंट नो कि सही है या नहीं, मैं आपसे पूछना चाहूंगी कि जो हम बोलते हैं कि प्रिजर्वेटिव्स आर कार्सिनोजेनिक, तो उससे कैंसर हो सकता है, तो इज इट ट्रू?
बेसिकली इस पर कोई रिसर्च नहीं है कि प्रिजर्वेटिव इज कार्सिनोजेनिक, बट अगर कोई भी चीज हम एक्सेसिव अमाउंट में लेंगे तो वो हेल्थ के लिए बेनिफिशियल तो नहीं है। लेसर अमाउंट इज ओके, बट अगर हम बहुत ज्यादा अमाउंट में कोई भी चीज जैसे प्रिजर्वेटिव यूज करते हैं या बहुत ज्यादा पेस्टिसाइड वाला फूड खाते हैं, जैसे आजकल जो सब्जियां आ रही है उसमें बहुत ज्यादा पेस्टिसाइड आ रहा है, तो बेसिकली हमको पहले उसको हम जब घर लाते हैं उसको हल्के से ल्यूक वार्म वाटर में नमक डालकर उसको सब्जियां फ्रूट्स को थोड़ी देर रखना चाहिए ताकि उसके ऊपर जो पेस्टिसाइड डाला गया है वो रिमूव हो जाए, उसके बाद हम खाएं। तो कहीं ना कहीं हम कैंसर प्रिवेंशन में ये थोड़ा हेल्प कर सकता है।
मैं भी पूछ सकता हूँ कुछ, एक थोड़ा सवाल है। अगर सेरम पोटेशियम, जिसका रेंज
यस
3.5 to 5 है, अगर
यस सर।
स्लाइटली अब वो दैट रेंज है, तो कौन
यस
से
सर।
फ्रूट्स एंड वेजिटेबल्स अवॉइड करने चाहिए?
सर अगर सीरम पोटेशियम हाई है तो हमें पोटेशियम रिच फूड अवॉइड करना चाहिए, जैसे कि आपका सॉरी सिट्रस फूड हो गए जिसमें हाई पोटेशियम होता है, ड्राई फ्रूट्स हो गए हैं ये हमको अवॉइड करने चाहिए। बेसिकली हमको देना चाहिए, जैसे एप्पल आप दे सकते हैं, बेरी स्ट्रॉबेरी आप दे सकते हैं जो कि लो एंड पोटेशियम होता है। आप कुकुम्बर पेशेंट को सजेस्ट कर सकते हैं जो लो एंड पोटेशियम होता है। तो ये सारे हमको अवॉइड करने चाहिए, और ये जो हम मैंने जो बताया ये हम दे सकते हैं पेशेंट।
ओके, थैंक यू।
ओके थैंक
Thank you, ma'am. Thank you, sir. Physiotherapy in cancer care is known about restoring strength, mobility, and confidence. Through tailored exercises and support, physiotherapists help cancer patients reclaim their independence, enhance recovery, and improve their overall well being, making every step of their journey a little easier. In view of this, I would like to request Dr. Subodh Srivas, Senior Physiotherapist, Indian Institute of Head and Neck Oncology, Indore Cancer Foundation, to please share their valuable insights with us today on the topic how physiotherapy can help cancer patients and how can you help.
Good afternoon, everyone. I'm Subodh Srivas, Senior Physiotherapist from the Early Integration Supportive Care Team of Indian Institute of Head and Neck Oncology. जैसा कि आप सभी अभी तक के प्रीवियस लेक्चर्स में सुन चुके हैं कि कैंसर किस तरह होता है, कि उसे कैसे डिटेक्ट किया जाए, कैसे प्रिवेंट किया जाए, किस तरह उसका ट्रीटमेंट होता है, और ओरल हाइजीन किस तरह मेंटेन किए जाए, ओरल कैंसर में किस किस तरह के मैनेजमेंट्स होते हैं। एंड अभी प्रीवियस लेक्चर में आपने सुना कि डाइट का इम्पोर्टेंट कैंसर और उसके उपचार के दौरान में कितना महत्वपूर्ण है। So I would like to introduce to all of you how physiotherapy important in the cancer and its treatment, and why and how physical activity is very important. As you all know that cancer, as you all know that previous slide please. जैसा कि हम सभी लोग जानते हैं कि nowadays everybody like sedentary lifestyle, and अच्छा हैवी फूड हर व्यक्ति जो है पसंद करता है और सेडेंट्री लाइफस्टाइल को पसंद करते हैं। आरामदायक जीवन और हेवी खाना जो है व्यक्ति की एक्टिविटी को कम कर रहे हैं। फॉर एन एग्जाम्पल, जिसका बहुत बड़ा एग्जाम्पल है ऑनलाइन शॉपिंग। खाने के लिए भी व्यक्ति जो है आजकल ऑनलाइन खाना ऑर्डर करते हैं, अपनी फिजिकल एक्टिविटी को कम करते हैं, एंड जिसके कारण क्या है, अदर डिजीज जो है ग्रो होती जा रही है, उसके साथ साथ में कैंसर भी जो है ग्रो होता जा रहा है। सो फिजिकली फिट होना, फिजिकली एक्टिव होना, which is very necessary to prevent the cancer, and during the cancer physical activity is more important. So my topic is how physiotherapy is helping cancer patient to making the difference in the life of cancer patients. Next slide. During the treatment, most of patients is complaining about the pain and discomfort. Patient become fatigued and weak, and patient having breathlessness. Sometimes patient complain due to the sometimes patient complaining about the joint range of motion, and during the treatment, patient gets swollen. Patient bodyguard part gets swollen, which is known as the lymphedema. And this swelling doesn't resolve by normal or general treatment. This is treated by the special types of treatment, which is known as the complete decongestive therapy. And due to the decreased range of motion, fatigue, weakness, and breathlessness, patient lost their balance and coordination, and patient is unable to stand properly for a long time, and they have difficulty in walking and maintaining the balance. Next slide. Why physiotherapy matter in cancer care? Because by the help of physiotherapy, we can improving the physical function and mobility of patient. By the using of some modalities and exercises, we can reduce the pain and discomfort of patient. By exercises, balance and coordination exercises, we can improve the balance and coordination of patients, by which we improve the quality of life, and which will help in support, which will help in cancer and its treatment and its recovery. Next slides. How we do in our hospital? We are doing with multidisciplinary team, which is known as the early integration supportive care team, which include a physiotherapist, dietitian, psycho-oncologist, physicians, dentists, Vedic doctor, and a nurse. We all work together with for our patients to improve their quality of life and treating the disease. About the physiotherapy, we took the patient in OPD. We took IPD rounds where we evaluate and assess the symptoms of patient like pain, joint range of motion, swelling, breathlessness. According to symptom, we plan a special exercise program for individual patients and guide them how to do, how much they have to do, and how much time they have to do in a day. Once in a day, twice in a day, or thrice in a day. Same thing also guided to the patient's caregiver and nursing staff to supervise the patient while doing the exercises. If anyone having any difficulty or any problem during the exercise, to intimate the physiotherapist. And same thing we do in follow up again, and reevaluate the symptom. And according to symptom, if their symptom increase or decrease, we re-plan the exercise program and update the exercise program for better recovery. Next slides. There are some physiotherapy technique we use in physiotherapy department, like range of motion exercises to improving the range, and to improving the strength and flexibility. We give the strengthening exercise program. For breathing difficulty, we guided breathing exercises. For mental distress or distress, we give the relaxation. We suggest relaxation technique. And if patient having any difficulty in mobility, we guide patient to mobility aids and assistive devices. In the picture we have, you see the previous slide. In the picture you can see that there is some modality we have in our department to decreases the pain and to make better feeling of patients. Next slides. If we talk about the range of motion exercises, we have two types of range of motion exercises: passive range of motion exercises and active range of motion exercises. For an example, post-operatively patient is unable to do the exercises, so we can start with the passive range of motion exercises. It means patient is unable to do, so we do within the pain limit of within the pain limit. When we started the passive range of motion exercises, and ask the patient to do same thing at the same time. And if patient is able to do actively, so we can improving the range of motion exercises with the full range of motion exercises and go for the strengthening exercise program. Next, please. So there are some strengthening exercises program. We use resisted band, weight curve, dumbbells. If patient is not having any tools for a strengthening program, so we guided the self-registered exercise program. Means patient has to register their movement by unaffected side or unaffected limb and doing the movement. Or we also guided some light weight shifting exercises and body exercises like squats and lunges, or for an example, or for upper limb, we guide the shoulder press and bicep curl exercises. We can give guide to improving the strength. Next slide, please. If patient complaining about the breathing difficulty, we guided the diaphragmatic breathing exercises, deep breathing exercises, and pursed lip breathing exercises. For diaphragmatic breathing exercise, ask the patient to कि पेट फुलाते हुए सांस लेना है और छोड़ना है. It is the deep diaphragmatic breathing exercises. And patient for deep breathing exercises, guide the patient to body को फुलाते हुए, शरीर को फुलाते हुए नाक से लंबी गहरी सांस लेना है और मुंह से छोड़ना है. For pursed lip breathing exercises, ask the patient to sit on the chair with back support and take a deep breath by nose and exhale from lips, closer lips. So this is for pursed lip breathing exercises. And sometimes patient become tense or in anxiety. So we can guide the mindful meditation. And for if patient having any tightened muscles, we guide the progressive muscle relaxation exercises. And deep breathing exercises also good for improving the mental health and mental well-being. Next slides. If patient complaining about the swelling, which is don't go by the general treatments, so which is known as the lymphedema, so we have the complete decongestive therapy management in our hospital, in which we have intermittent pneumatic compression machine, which is seen in the picture, and we also give the manual lymphatic drainage to improve the local fluid circulation to move toward the decongested area. And after that, we guided the multi-layer lymphedema bandaging or compression garment to maintain the local blood circulation, and also guide exercise in the compression garments also, by which the muscle pumping action took place and improving the local blood circulation and preventing the further edema. Next slides. There are some mobility aids as I already discussed. Patient is unable to walk or stand, so we can guide the walker, cane, chairs, wheelchairs, and the spirometry for the breathing exercises. And we also guided the jaw stretcher key exercises for the if patient in for an example in oral cancer, patient is unable to open their mouth, so we can guide the jaw stretcher key. If patient is unable, patient don't having jaw stretcher key, so we can guide the ice cream stick exercises. The put the ice cream sticks in the mouth and hold for 5 to 10 minutes, then remove it and start the mouth opening exercises, by which the range of motion of temporomandibular joint is improved and mouth opening is initiated. And we also guided the compression garment and multi-layer lymphedema bandaging to prevent the lymphedema. Next. There are, as you all know, that there are some benefit of physiotherapy in cancer care, like improving the physical function and mobility. There is a reducing the pain and discomfort, and by which improving the quality of life, which will also support in cancer treatment and its recovery. Next. As you see that physiotherapy play a very crucial role in cancer care to improving the quality of life by improving the physical function, reduce the pain, enhancing the quality of life. And you also guided the exercises to the patient or other kind of patient to nearby you. And I will be very happy to give your answer or give the answer of your question if anybody have. Thank you.
Thank you so much, sir, for sharing how physiotherapy helps cancer patients. Ayurveda is the art of living in harmony with nature, where health is not just the absence of disease, but a state of balance and well-being. Through its timeless wisdom, it guides us towards healing, prevention, and rejuvenation, empowering the body to restore itself to its natural state of health. To make our audience familiar with Ayurvedic perspective for healthy life and how we manage side effects with Ayurveda, I would like to request Dr. Sonali Gore, MD Ayurveda physician at IIHNO Rao, to share their incredible insights with us.
Hi, good afternoon, everyone. Myself, Dr. Sonali Gore, working as an Ayurveda physician in Indian Institute of Head and Neck Oncology. तो इंदौर कैंसर फाउंडेशन में पिछले 4 वर्षों से ट्रांसडिसिप्लिनरी यूनिवर्सिटी बेंगलोर के साथ समझौते के अंतर्गत आयुर्वेद विभाग को विकसित किया गया है। पीडीयू के डॉक्टर प्रसन्ना शंकर के मार्गदर्शन पर सपोर्टिव केयर में कीमोथेरेपी और रेडिएशन के दुष्प्रभावों के लिए आयुर्वेदिक उपचार किए जाते हैं। So have you heard about Ayurveda, or what are your initial thoughts about Ayurveda? So the Ayurveda is science of life. Ayurveda is traditional Indian system of medicine that focuses on holistic health and well-being by addressing the physical, mental, and spiritual aspect. So the aim of Ayurveda is maintain health through lifestyle practices, herbal remedies, and dietary adjustment based on individual's unique constitution. So next slide, please. So this individual's unique constitution is called a dosha in Ayurveda. So there are the core principle of Ayurveda is balance of these 3 doshas, that is Vata, Pitta, and Kapha. So in Ayurveda, these core principles can be related to the basic biology of the body. So we need energy to create movement so that fluids and nutrients get into the cell, enabling the body to function. This energy also requires to metabolize the nutrient in the cells and also to lubricate and maintain the structure of the cell. So Vata is the energy of movement, Pitta is the energy of metabolism and digestion, and Kapha is the energy of lubrication and structure. So according to Ayurveda, the cause of illness is excess or deficiency of these 3 doshas, that is Vata, Pitta, and Kapha. So as per Dr. Dharkar sir and Dr. Priyanshu sir mentioned how can we reduce the risk of cancers. So for this, we need to follow Ayurvedic daily routine or Dinacharya according to Ayurveda. Next slide, please. So how we can achieve this goal of good health by Ayurveda? So we can achieve this goal by aligning our daily life with the cycle of nature. So this is the 24 hours clock, and this clock is showing the specific time of doshas in specific time period. So you can see this is morning 10 a.m. to 2 p.m. is the kala of Pitta dosha. Then 2 p.m. to 6 p.m. is the kala of Vata dosh. Then evening 6 p.m. to night 10 p.m. is the kala of Kapha dosha. Again 10 p.m. to 2 a.m. is the kala of Pitta dosh. Then 2 a.m. to early morning 6 a.m. is the kala of Vata dosha. And again 6 a.m. to 10 a.m. is the kala of Kapha dosha. So Ayurveda daily routine is following this cycle of nature. Okay. So first thing to key step towards a good daily routine is waking up early. So the ideal time for wake up early is 4 a.m. to 6 a.m. That is before sunrise. And when this is possible, so this is possible when you go to bed till 10 p.m. Again, this small change of waking up early gives you lightness, freshness, and creativity. Because as per I have mentioned, this is the kala of Vata dosha. So Vata is the energy of movement. So if you wake up early, so this is the kala of creativity. Okay? And if you sleep in and waking up during Kapha means during 8 to 10 a.m. This is the kala of Kapha dosha. So healthy qualities of Kapha is sluggishness or heaviness. So when you wake up late in the morning, you will feel like heaviness. Okay. So next thing is outer and inner cleansing. First, thoroughly face your wash. Then all of we know mouth hygiene, carefully brush your teeth and clean your tongue also. So how we clean our tongue? So clean your tongue with scraping. And cleaning of mouth is why important? Because of lot of waste material is accumulated overnight on according to Ayurveda. So this how we can clean this ama with Ayurveda. So there is one term mentioned in Ayurveda, that is gandush, gargling. So the aim of this gargling is free your body from accumulated ama or waste product. And for this, we can use some Ayurvedic home remedies, that is lukewarm water with haridra, lukewarm water with honey, and put it in your mouth, gargle with it, switch it around your mouth approx for 4 to 5 minutes, and then dispose it. Then after that, drink 1 to 2 cups of lukewarm water. And this drinking of lukewarm water is triggers your bowel and bladder movements naturally. Then if you have time, go for, ma'am, next slide, please. Next. 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 Next, ma'am. Next. Yes. If you have time, then go for short brisk walk. That walk will stimulate your circulation, metabolism, and brighten your mood. Another one thing mentioned in Ayurveda, that is Abhyanga, that is Ayurvedic oil massage. And this will bring strength to your dhatus, that is muscle, body tissues, and bones. And also have calm up your nervous system. Then about exercise, that is yoga, asana, pranayama, or breathing exercise. So when you practice regularly with attention and awareness, this exercise can noticeably increase your physical and mental well-being. Nowadays, this is the spiritual concept is very important. So next is meditation. Just like physical cleansing, inner cleansing is also an essential part of Ayurvedic morning routine. And this will give us inner deep peace and clarity. Now we come to breakfast. 7 is breakfast. So you should breakfast by 8 a.m. or by latest 9 a.m. Since, as I have mentioned, this is a kal of kapha dosha. So during kapha dosha, our digestive fire or agni is no longer very strong. Therefore, your breakfast should be very light. And if you are not more hungry, then you could have some seasonal fruits or some dry fruits such as figs, nuts, dates, okay, and or a porridge with grains. And keep some things while you eating. Never eat in a hurry or never eat in while standing, walking. Take 10 to 15 minutes to have comfortable breakfast in peace, and this will allow you feel unwell. And next, select your clothes according to season and according to your doshas. So next is we will come to the Ayurveda in afternoon. So this is about lunch. So lunch, the ideal time to have lunch is 12 or by latest 1 p.m. because sun it's at peak, and so our digestive fire is very strong and ready for main meal of the day. Okay, so when you are selecting your dishes or drinks, match with your doshas and match with seasons. About afternoon nap. So according to Ayurveda, afternoon nap is not advisable. Then continue your usual activities and end of the second creative phase, and will gradually steer into relaxing evening. Thank you. So it's Ayurveda in the evening, it's about dinner. According to natural rhythm, you should have dinner at the latest at the 6 p.m. to 7 p.m. Again, this is comfort time. So with weak digestive fire. So to avoid unnecessary strain on your digestive system during night, dinner should be very light. And if you like, you can take 10 to 15 minutes walk after dinner and then turn into pleasant, relaxing activity. Ayurveda suggests staying away from exciting thrillers, computer works, and too much television, and nowadays too much mobile. Okay. Next is go to bed early. You should go to sleep till 10 p.m. at the start of Pitta time. And if you are still awake after 10 p.m., your mind and body active again. So that you have made trouble falling asleep and then sleep occurs very late. So you go to bed early. Now you can see how these very simple things you can implement in your daily life and gives you positive impact on your health and on your loved one's health. So next is nowadays there is one question is Ayurveda is safe for cancer. So Ayurveda offers treatment aimed at strengthening the body's resilience, supporting mental and emotional well-being, and reducing side effects from conventional cancer therapies. While Ayurveda is not a replacement for evidence-based cancer treatment. So how we are managing side effects with Ayurveda in our institute? So we are managing side effects like radiation-induced mucositis with Ayurveda gargling, local application of medicated Ayurvedic grita, and when necessary, when there is grade 3, grade 4 mucositis, we are using internal medicines. Also, we are using some Rasayan Kalpa like Shatavari Ashwagandha, Arishta for immunity or for some patients for weakness and some chemotherapy related side effects. Okay. So, thank you. So, my sincere gratitude to Sri Vaishnav Vidyapit Vishwavidyalaya for giving me this opportunity. And also thanks to each of you for taking the time to join. Thank you, ma'am.
Thank you very much, ma'am, for sharing your insights with us on how we can minimize side effects in patients dealing with cancer with the help of Ayurveda. Open communication, empathy, and a non-judgmental attitude are vital in creating a safe space where cancer patients can freely express their fears and hopes, fostering emotional healing. To explore this important aspect, I would like to invite Ms. Pooja Patel, counselor at the Indian Institute of Head and Neck Oncology, Indore Cancer Foundation, to address the audience on the topic empathy, non-judgmental attitude, and the need for communication during the stress of cancer treatment.
Hello everyone. My name is Pooja Patel. I am a counselor and psychologist at the Psycho-Oncology Department, which is a part of early integration of supportive care team of Indore Cancer Foundation. My objective for today's talk is to make you understand the hidden struggles of a cancer patient and their families, so that you can spread the awareness around you as well. Let me start by explaining why there is a need of psycho-oncology. As we know that cancer is not just a physical disease, it affects the person's whole well-being, the way they feel, their social life, and the way they behave. Psycho-oncology focuses exactly on these aspects. As a part of EISC, we also aim to address all these aspects of cancer, under which our primary focus is on emotional and psychological needs of cancer patients and caregivers, because we observe that symptoms of anxiety and depression are common in patients living with any chronic condition. Next slide, please. Let us think for a moment. Try to conceptualize with me. Think that you have an exam tomorrow, and today you feel that you have not asked enough questions or have your queries resolved in the class, what do you think you will be feeling? Of course, there is going to be fear. So that is how the patients also feel when they start the treatment. We at our institute start to work as a team from the day when patients first come for the consultation with doctor, just like an alchemist works with the hidden emotions, just like an alchemist works with the chemicals, we work with the hidden emotions that the patient comes to us with. The hidden emotions are majorly like fear, worry, guilt, which is often present in almost every person coming to the institute. We transform these emotions later into resilience and courage, which results in better treatment adherence and also the better quality of life for patients and their families. Now, to put this into context, uh, I would request each one of you to think of a family member, a relative, or a neighbor that you heard of taking treatment. What emotions, feelings, or images first comes to your mind? Think of that for a moment. Next slide, please. Here is a list of few common concerns and complaints that patient comes to us with, which includes fear, financial issues, pain, lack of understanding of treatment modalities, and the list goes on. Because we are interacting virtually, and I cannot ask you all of your responses, but one thing that I could tell, which each of you would have guessed, which is pain, if eating difficulty, and hair fall, and all these combined as side effects of the treatment. The first thing that comes to mind is mostly negative and not the patient getting better. So your attention coming to this, next slide, please. So your attention coming to this is what we call as negativity bias. Your attention going to this is not a problem in itself, but when it stops you from taking treatment, is when we have to keep a check on this. Now, so now we know that our brain is also capable of tricking us. Think again of the person you thought of, and in any case, if your intent is to help them in any way, let me share a few strategies with you that can be helpful uh, for you to do just that. Next slide, please. The first skill that we all need to cultivate in ourselves is of empathy. Now, you may or may not have heard of this term before. So let me explain. Empathy is the ability to understand and to imagine how other person is feeling, not from your perspective, but from their perspective, how he or she might be feeling. You can think for this. Next slide, please. You can think of this as uh, putting your feet in their shoes, understanding their problems, how the shoe might be hurting. You will not be knowing if you try to keep your shoe in your feet. Uh, for this, the second skill that goes along with it is of listening. So you have to listen carefully, not just in terms when it comes to cancer, but uh, in any life situation also. Listening is the most important thing that we all need to have. And the second is non-judgmental attitude. Means not deciding about whether someone's behavior or response is right or wrong. For example, when you see a cancer patient cry, don't just think that uh, he or she is crying because he is weak, because the crying is not a sign of weakness. When you observe them in an irritable mood, don't assume that he's intentionally behaving like that to cause trouble to others. Maybe he's irritable because he didn't have enough sleep last night. Next slide, please. Third is prevent unintentional harm. If you observe someone saying around patient statements like, everything is okay, you are completely healthy, the patient knows well that he is not. And you never know how these words might be triggering the patient on a deeper level. Another case is when others try to tell the person, see how we told you to not consume alcohol and tobacco. Of course, now you have developed cancer. We know that cancer has a lifestyle factor to it, but as a cause, uh, but reminding them again and again is not going to help. And instead, stand alongside the patient when they have decided to quit. Next slide, please. Encourage self-management. Let the patient take an active role. It is a tendency of every one of us to think that the patient might need our help, and we try to help them in every way that we can. But when it comes to when a patient who is taking treatment, it is important that they have to feel that emotion of sense of self-control, that they are managing their own symptoms and they are deciding for themselves. This can give them a feeling of sense of achievement in themselves, which will add to their recovery as well. Next slide, please. Open communication. Now, open communication plays a very crucial role because providing the patient and the caregivers a safe space to talk about their negative experiences or their issues is very helpful. Negative experience, we define it as distress. In psycho-oncology, there is a definition for that as well. We keep a check of the levels of distress that which I'll discuss in my later slides as well. Examples for this is like we often observe that patients come to us and they want us to explain like what these symptoms mean, but the family members are so reluctant that they don't want us to disclose the diagnosis to the patient, and they don't want that patient would be fearful and it will be very difficult for them to manage. So they think like it's better to not tell the patient about their diagnosis. So we need to work on these aspects as well. So this also comes under the role of psycho-oncology department. Now, next slide, please. This is the sixth strategy, which is respect boundaries. When a patient is not wanting to meet anyone, or he's saying to give them a space, it's necessary that we respect that, because at times the patient might be in actual pain and not actually wanting to meet other people. So respecting that also helps to the patient. Next slide, please. Now, this is the last strategy that from my side, which is more often we observe that in rural populations, the myth of cancer being contagious is very common. You may not feel of that like this to be very prevalent, because we come from a background where we know that cancer is not contagious in itself. But in rural population, this myth is very common, and they start self-isolating, and they also withdraw themselves from the society in order to not harm others. So this myth also needs to be busted in sessions, which ultimately helps in better management of the disease. Something that cancer means death, which is also, they even call it as a cancer means cancel, that life is no more after that. So this myth also needs to be busted. It can be cured. This awareness needs to be spread. So that everyone who are having symptoms can get the treatment and get cure as well. I hope what you learned today, you will be aware, sharing this awareness with others as well. Previous slide, please. Previous slide, please. Here are a few references of the materials that I have used, in which includes a distress thermometer, which is NCCN guided, which is an internationally accredited tool that we use for distress screening at our institute. Next slide, please. Thank you for your patient listening, and I really enjoyed interacting with you all. I hope you also had a great time. Thanks.
Thank you, ma'am.
I have a question. Actually, I have question for the people who have recovered from cancer, but experience stress about the possibility of getting cancer again. So, what can they do to overcome from this kind of stress? Am I audible, ma'am? Pooja, ma'am?
Sorry, yes. Yes.
Yes.
So this is a very common theme that we observe in our sessions as well, when the patient comes on follow-up with the doctor after the completion of treatment. So in this, when we check for reintegration, like how the person is doing in the life as it was before the diagnosis. So the fear of recurrence is very common, but when it affects the daily functionality of that person, that is when we call it as a abnormal thing, because a patient who has had cancer, it is a fact that will have more probability of developing cancer again. So anxiety is not, so developing cancer again, this anxiety is not a problem in itself, but it helps patient to keep coming on the regular follow-ups. So there are a few strategies that we give them to not let the fear impact their life as much. I hope I've answered your question.
Thank you. Thank you, Pooja ma'am, for highlighting the role of a counselor in the journey of a patient's healing. Proceeding further, for concluding remarks and to express a word of appreciation and gratitude, I now request Coordinator, Friends of Indore Cancer Foundation, SCCC Chapter, Dr. Supriya Vyas, Assistant Professor, Department of Chemistry, Sri Vaishnav Institute of Science.
Thank you, ma'am. Good afternoon to all. Gratitude is a silent prayer that needs no words, only a heart that truly feels it. On behalf of Sri Vaishnav Vidyapeeth Vishwavidyalaya, I, Dr. Supriya Vyas, Coordinator, Friends of Indore Cancer Foundation, SCCC Chapter, feel honored and privileged to get the opportunity to propose a vote of thanks for this webinar. First and foremost, I want to extend my sincere, heartfelt thanks to Dr. Dikpal Dharkar, Surgical Oncologist and Honorary Secretary, Indore Cancer Foundation Charitable Trust, for his unwavering support and timely guidance whenever it was needed. So I hold immense respect for you. I would like to express my profound gratitude to Dr. Upinder Dhar, Vice Chancellor SCCC Indore, for giving permission to organize this program and for being a constant source of motivation and the guiding lamp for every new step forward. I would also like to convey my deep appreciation to our distinguished speakers, Dr. Priyanshu Tripathi, Dr. Kritika Kulkarni, Subodh Shivas, Dr. Sonali Gore, Ms. Pooja Patel, for joining us today and sharing their profound insights during the webinar. A special note of thanks goes to all the respected directors, heads, and faculties for their generous supports, without which this event would not have been possible. I would also like to acknowledge the hard work and dedication of our technical team, who ensured that the webinar ran smoothly from start to finish. A special thank to Dr. Ujjwala Daswani, Dr. Aarti Sharma, Dr. Namnita Upadhyay, and all the fellow team members who worked to plan, promote, and execute this webinar flawlessly. Lastly, I am happy to express my thanks to our participants present here for paying attention and learning. As we conclude this event, let us carry forward the inspiration and knowledge we have gained today to make positive changes in our lives. Once again, thank you all for being a part of this wonderful event, and we look forward for future opportunities to come together. Thank you and have a great day.
Thank you, ma'am. Now I request everyone to kindly rise for the national anthem.
जन गण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
भारत माता की जय।
Thank you all for your cordial joining. Thank you all.